Knee osteoarthritis, or KOA, is a common and often painful condition that affects millions of people, especially as they age. For years, doctors have relied on corticosteroid injections to help manage the chronic pain that comes with KOA. But just how effective are these injections compared to other options? A large multi-site clinical trial set out to answer this question by comparing corticosteroid injections to lidocaine-only injection. Study included over 220 participants from 4 major Veteran Affairs medical centers, all aged between 40 and 80 and all diagnosed with KOA. The goal was to see if corticosteroids truly offered a meaningful benefit in reducing knee pain and improving function, or if a simpler treatment like lidocaine could be just as effective. Let's dive into what the researchers found. To ensure reliable results, the researchers used a rigorous randomized crossover design. Participants were randomly assigned to receive either a corticosteroid plus lidocaine injection or a lidocaine-only injection, with the treatments blinded so neither the patients nor the doctors knew which was given. After a set period, participants switched treatments, allowing each person to serve as their own control. Main outcome measured was the change in the knee osteoarthritis outcome score, or KOOS, over 12 weeks. This score reflects pain, symptoms, daily activities, sports, and quality of life. A change of more than 10 points was considered clinically meaningful. The study also looked at secondary outcomes like pain intensity and interference, and included subgroup and sensitivity analyses to ensure the findings were robust across different patient groups. Surprisingly, the results showed that corticosteroid injections did not provide a significant benefit over lidocaine-only injections for knee osteoarthritis. Across all measured outcomes, including the total KOOS score and secondary measures like pain and daily function, there was no meaningful difference between the two treatments over 12 weeks. Probability of achieving a clinically important improvement was only slightly higher with corticosteroids, but the difference was not statistically significant. Even when participants switched treatments in the crossover phase, the results remained consistent. These findings challenge the common practice of using corticosteroid injections for KOA and suggest that lidocaine-only injections may be just as effective for many patients. This raises important questions about how we manage knee osteoarthritis in real-world settings. For patients and healthcare providers, these findings are both surprising and important. They suggest that the routine use of corticosteroid injections for knee osteoarthritis may not be as beneficial as previously thought, at least in the short term. Lidocaine-only injections, which are simpler and may have fewer side effects, performed just as well in this large, real-world trial. This could lead to changes in how doctors approach pain management for KOA, encouraging more personalized and evidence-based decisions. As always, patients should discuss their options with their healthcare providers, considering both the potential benefits and risks of any treatment. This study highlights the value of large, pragmatic clinical trials in challenging assumptions and improving patient care.